Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about systemic lupus erythematosus. SLE is a common problem, I guess not that common, but it is a relatively common cause of arthritis in the foot and ankle. Systemic lupus erythematosus causes inflammation in the joints, causes significant discomfort, and it can affect multiple areas of the body. It can affect the skin, it can affect the joints, it can affect kidneys, brain, and other organs. But in the feet and ankles, it is commonly, initially, the primary thing is to cause arthritis. Inflammation of the joints, damage to the cartilage and joint surfaces, and actually can be pretty problematic and pretty severe pain or discomfort when that is happening, to the point that even when they get treatments for the SLE, for the lupus itself, they will often still have the swelling and some discomfort in the joints of the foot and ankle. That being said, SLE can also cause a secondary problem, which is Raynauds Syndrome, which is a situation where the skin or the toes turn blue from sensitivity to the cold. So why is that a problem? SLE, or lupus, is a autoimmune disease where you're actually attacking your healthy tissues in the body. And in this case, it can attack the joints, like we've already talked about, but it can also attack the small blood vessels, causing them to constrict with the exposure to cold. So instead of having a true Raynauds, where you have a Raynauds abnormality in the blood vessels, you actually have an autoimmune disease that's attacking the blood vessels and causing the same symptoms. You can also have some numbness and discomfort secondary to the poor blood flow, and with Raynauds or the lupus itself, you can actually get sores or wounds on the feet. So that being said, the whole idea is that a lot of times you need to be evaluated for this type of problem. They can do a physical exam, and they can actually look at different areas. A lot of times you'll have a butterfly rash on the face if you have systemic lupus erythematosus. There's actually blood tests that they can actually run to determine if you have this, including the CRP and the ANA panels, to determine if you actually have certain types of diseases. Treatment-wise, treatment will depend on how severe the problem is. So how active is the disease, what parts of the body are affected, and that will determine what types of treatment can be done. So you can do anti-inflammatories and steroid-type treatments, including corticosteroid at high doses for certain situations. But you can also say, okay, I need to wear protective clothing. I need to do preventive-type care for other areas, possibly heart, stuff like that, to ensure that there aren't problems. With arthritis, you're going to limit damage or motion to those joints. That can actually decrease the problems from SLE. Not smoking, as we've talked about in previous videos. As you smoke, you can actually cause further contraction of the blood vessels, and this can actually aggravate or exaggerate the problems that come from SLE. Alcohol, similarly, because of some of the effects that it can have on the systems of the body, can also be problematic for those that have SLE. So if you are diagnosed with lupus or systemic lupus erythematosus, it is recommended that you do some things to reduce the damage and prevent the damage, but also that you treat symptomatic those problems that are becoming more of an issue. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 127, Systemic